I'd love to share the story of Aman Cataract surgery with you. This was a probably the world's first cataract surgery done in the orangutan. I done it in 2005 after being invited to go and examine a man that was blind and possibly had cataracts. This is Aman, a 19-year-old male orangutan, and he was blind at the time of my initial seeing him due to cataracts. Now, Aman was bought in a black market in Singapore. He was then eventually rehabilitated at the Matang Wildlife Center in Sarawak, that is in Malaysia and Borneo. This is just an image of a infant orangutan. It's not Aman, but they are really cute little things. And unfortunately, due to that, they do end up being sold on the black market. At some stage in his life, Aman decided to chew through an electrical cord. He destroyed part of his tongue, and we also suspect that that may have been the reasons for his developing cataract, which is an opacity of the lens. So when I was initially contacted to examine and to possibly do surgery on Aman, this took a huge amount of planning. It's not just a question of go there and do surgery. There was logistics involved, getting everything across there. There was the issue about post-operative treatment, was he's going to need post-op eye drops, and being blind, he's still a wild orangutan, so he was trained before the surgery by the staff at Matang Wildlife Center to actually grab a banana and get at that stage just a placebo eye drop in his eyes. But we needed to get him used to being able, or used to getting drops being put into his eye. So there was a lot of planning, there was a lot of logistics to get all the equipment and the drugs and everything across to Borneo from South Africa. A lot of times the question was asked, why all this effort for an ape? Well, firstly, but not important, most importantly, but orangutans are an endangered species. Unfortunately, the natural habitat, being the rainforest, is being chopped down for the palm oil industry. And secondly, orangutans are just absolutely amazing creatures. They are highly intelligent, very human-like. And I personally just wanted to do this to improve his quality of life. It was at that stage he was confined to a cage as a blind male grumpy orangutan. So after months of planning and getting everything together, we got to Borneo and we got all our equipment together, and eventually it was the day of the surgery. Again, this is Aman, and you can clearly see the cataracts in both his eyes. So this was all done in a very primitive fashion. We set up a little theater outside the cages, so this is very far from a nice ventilated first world surgery. Although we've done first world surgery, microsurgical instruments, fancy phacoemulsification equipment, anesthetic equipment, anesthetic monitoring equipment. So all of that we took with us, and I was assisted by Professor Frik Stegman, an anesthesiologist. At that stage, he was working at the University of Pretoria, and Dr. Aman Siva, who is one of my postgrad students. He is currently a veterinary ophthalmologist working in Kuala Lumpur in Malaysia. So we set up this little space in the corridor between the cages, and we've converted this into a little makeshift theater. At least we had electricity, we got medical grade air and oxygen to run the equipment. This is a man in his cage, pre-op, waiting for his anesthetic, and then we started with the procedure. Now, the biggest, as far as I'm concerned, the most difficult part of the procedure was just sedating and anesthetizing him. And fortunately, that was Professor Stegman's expertise, and he did a brilliant job in sedating him, finding veins, getting him into an intravenous anesthetic, and then eventually intubating him and getting one onto full-blown gas anesthesia, which gave us a really nice, stable anesthetic for the entire procedure. So just some photographs of Prof. Stachman busy setting up the anesthetic machine, Dr. Amilan getting things ready. This is Prof. Stachman intubating Aman. Again, a fairly difficult procedure to do, and also Aman's got a piece of his tongue missing, making things even more complicated. Once anesthetized, I've done some preoperative function tests to make sure that the rest of the eye is absolutely normal. It's pointless doing cataract surgery if the rest of the eye is not functional, so I've done an electrical function test called an ERG on the eye, and I've also done ultrasound where we can visualize the cataract, which is this opaque lens, but we have to make sure that this jelly portion or the vitreous is also clear. So I've done all those preoperative tests and they were all clear. And then we went ahead and actually start preparing him for surgery. Because this was possibly the world's first orangutan cataract surgery, there was huge media involvement. We can see all the cameramen there, which didn't really aid to our stress levels. This was hot, humid Borneo. I was soaked in sweat. It was a fairly stressful day, but actually looking back a really rewarding day. So just some more images of Aman being positioned on the table with Prof. Zachman, Amilan, myself working, making sure that everything is in position. This is Amilan preparing the eye for surgery, just clearing him, getting the position right. Photo of the little portable operating microscope that we brought across. There's a ventilator for the anesthesia, the anesthetic machine. So there was a lot of equipment involved to really do this as first world as possible in a very difficult situation. This is Amilan in position for his surgery. Now, for those of you watching this that's ever done cataract surgery on an animal or for the physician-based ophthalmologist, looking at this is a nightmare. Very small eyes. We've got this very huge nose in the way, this forehead, this flanges. So just getting into the eye was just an absolute nightmare, just from a positioning point of view. And that was my personal, like, real struggle, was just to position old Aman to be able to actually do the surgery. And that's me. Busy with the surgery, putting in an eyelid speculum. Um, the reason for my really fancy surgical attire without surgical pants, it was a hot, humid, very typical Borneo day, so I got there with my shorts, and when I wanted to put my theatre pants on, I found them sitting in a tree with a orangutan, semi-wild orangutan that came into the building and stole my pants. He looked very impressed with himself with his green surgical pants up in the tree. Anyway, so that was also part of the fun. So I've removed the lenses with a technique called phacoemulsification, which is the latest state-of-the-art way to do cataract surgery, where the contents of the lens is removed with high-frequency ultrasound. I don't want to bore you with nitty-gritty facts about phacoemulsification, but basically the surgery is done through a 3.2 millimeter corneal incision. The front capsule of the lens is very carefully removed, and then this high-frequency ultrasonic instrument is inserted into this lens bag, and the contents of the lens is then aspirated or emulsified and then aspirated, and at the end of the surgery we're left with a little bit of the front capsule, the back capsule, but the cloudy contents is removed. This is just a photograph during the surgical procedure. Normally, we would try and replace the lenses with an artificial foldable acrylic lens. Unfortunately, in Aman's case, I had some intraoperative complications where we've lost the posterior or the back lens capsule, and I wasn't able to implant artificial lenses. And at the end of the day, I've made the decision to leave him aphakic or without a lens, which means he would have been, or he will be, or he is long-sighted. Some more photographs of the surgical day. Someone on the table. Some more images of him. Again, what an amazing creature. Just look at that hand. And then you can see all the monitoring equipment that's around him. So this was really, we've done everything we could to do this as safely, as controlled as possible in a fairly difficult environment. So ultimately, he was recovered back in his little cage. Recovery went well. He got up without any issues, and yeah, so the surgery was a success. So after a couple of days, Aman could start seeing again, although he was long-sighted. That was actually one of our problems at that stage, because preoperatively, when we were training him, or when the staff at Matang was training him to take his eye drops, he was quite good. He took his banana and he took his drops, and he was fine. But post-operatively, after a day or two, when he started seeing, he took his banana and then said, "Thank you very much. I'll have the banana, but I'm not having the drops." So, fortunately or unfortunately, we couldn't really medicate him as I wanted to. Fortunately, he didn't develop any complications. He didn't get post-op infection, inflammation, glaucoma, which is all the really nasty possible complications that we may get after cataract surgery. Yeah, so Aman went ahead. He is now a father of a little baby, and he's still in a semi-wild situation. He will never be able to be released back into complete wild, and there's a whole bunch of reasons for that. Anyway, I'd love to share this story with you. If you like this, please like this video. If you want to follow, we'll get more of the same stuff. Please follow this channel. I will be posting other similar type of stories. Um, in the next couple of weeks, I will post another thing. I went back to Malaysia, or back to Borneo, this time to Indonesian Borneo, to a little place called Pangkalembun, to do cataract surgery on another orangutan, this time a female called Rosemary, which was another really emotional story. But I will post that at a later stage. Thank you.